Hi, I decided to do my PowerPoint on anorexia. Background of this, anorexia is also known as anorexia nervosa. It is an eating disorder. It can be very life-threatening and it can affect any age. There's two main types of eating disorders. There's either anorexia nervosa and bulimia nervosa. Um, these type of people tend to struggle with the weight that they're supposed to be based off their height. Um, Even though I did say that it can happen to anyone, which it can, it is most prevalent in women and young adults. Um, People who struggle with this disease tend to count the number of calories that they are intaking and what types of food they are intaking as well. So diagnosis, DSM is the criterion that was laid out by the Diagnostic and Statistical Manual of Mental Health Disorders. It will contain a certain amount of materials like symptoms being experienced, and then it is categorized so that the clinicians can diagnose a patient properly. They will also use this when they are with the psychiatric um, doctor as well to try and see what types of symptoms they're having there as well. Some of the criteria they have to meet for this, for them to be considered, is they have to look at the restriction of energy versus low body weight, of the age and the sex, along with their physical health. They will also explore how intense their fear is of gaining weight or being fat, and then also how much denial the patient has. Causes, there are many different causes that can cause someone to have this disorder. Some people do believe that there is a genetic precursor that it triggers them to start having the eating disorder, but none has been pinpointed yet. Environmental causes include people on the media having a big influence on them. They want to be looking just like them. They wonder why they can't be skinny. They think that they're the perfect weight, so then they get obsessed with trying to become that perfect person, and then they get too skinny, and then they just keep going and getting worse and worse and worse. Some biological effects include irregular hormone function or genetics. Once again, are to be a trigger for eating disorders, but still they do not know. And then another environmental one would be sexual abuse or severe trauma that has happened in the past that would cause this disorder, because they're like, why me? Like, what's wrong with me? And then they try and change their whole body. Signs and symptoms include denial of being hungry. They develop food rituals. They will have dramatic weight loss. They will be hiding their weight loss based off of wearing baggy clothes or lots of layers. They will make comments about being fat. They won't like to eat in public. They will complain of constipation, cold intolerance, excessive energy, lethargic, abdominal pain. They will also become dizzy, have sleep problems, syncopal episodes, dry skin, yellow skin, dental issues because they're vomiting all the time, and then impaired immune functioning. There are a lot of side effects when it comes to anorexia. They can become anemic, which means that they would have iron deficiency, or their immune system could be compromised, which is more likely to get them sick more often, putting them at a greater risk for developing other things. They will have intestinal problems like diarrhea, constipation, abdominal pain, and they can also become infertile because of this, because they're not getting their menstrual cycle on a regular basis. So the renal function, it does affect the renal function, and kidneys Specifically, it will be hard for them. The kidneys are responsible for filtering and excreting the waste from our bodies, and when a person is anorexic, it makes it really hard for them to be able to do that because they're normally very dehydrated, which is one of the major contributors to having kidney damage. So you can see here in the photo that these are kidney stones, and kidney stones are very common in anorexic patients because kidney stones develop when they're not getting the right amount of balance of electrolytes and dehydration and having hydration. Pulmonary function system, because of being anorexic, emphysema can happen because of malnutrition. And that's exactly what anorexia is. This will occur because of the restrictive number of calories that the person is intaking. It'll also lead them to being more susceptible to disease in the environment. So this left diagram obviously shows a healthy heart, and then this is emphysema when the lungs are starting to die off. Emphysema is where air sacs found within the lungs are damaged, causing them to enlarge and making them harder to breathe. So this is a huge fact, and when this happens, it makes it harder for the other systems in the body to get the proper oxygen that they need, along with the blood flow that they need, which then causes those organs to die. The circulatory system, it could just start off as chest pain. When people are anorexic, they lose a lot of weight, and they also lose the amount of muscle mass that they have, which includes cardiac and skeletal. So when there is muscle loss of the cardiac muscle, this can cause a mitral valve prolapse, which will cause you to have a sharp pain right underneath the sternum. Another thing that can happen is cardiomyopathy, which makes it harder for your body to pump blood to the rest of your body because you don't have enough muscle mass to help push it out to the rest of your body, which once again then will start to kill off those other organs because they're not getting enough nutrients, they're not getting enough oxygen, and so it makes it hard for them to survive. The cardiovascular system will cause hemodynamic changes and structural changes. It can also cause premature death. That goes hand in hand with the circulatory system. They're very similar. They both deal with the heart and they both deal with the blood. There's just different parts of it. But the cardiovascular system is definitely affected in this. The gastrointestinal system, this will cause constipation because they're not getting enough nutritional value in intake, so that it makes it hard for them to eliminate. It also causes the muscle within the intestines to become weak, which then doesn't give them enough strength or energy to be able to push out and eliminate it, which is why people become constipated. And then if you constantly using a laxative, you will become dependent on it because you're killing off those nerve endings, nerve fiber endings, which then makes it impossible for them to poop on their own. So neurological systems, dieting, fasting, or self-starvation will cause the brain to not be able to get enough energy it needs to survive. This can cause your brain to be obsessive over food and highly distracted. Some electrolytes like potassium, calcium, and chloride are responsible for sending signals to the brain and to the body. When there is severe dehydration and the electrolytes are imbalanced, it will cause seizures and muscle cramps. When the blood vessels in the brain cannot push enough blood to the brain, it will cause dizziness and fainting. So you can see here how much of it has died due to not being able to get enough nutrition, get enough oxygen, and get enough blood flow through the brain and through the rest of the body. It can show you how much weight loss a person is having and how it not necessarily can turn back to normal even if you do control your symptoms of being anorexic. The endocrine system is responsible for hormones that are made up of fat and cholesterols that we eat. When we do not consume enough of it, it will cause the hormone levels to fall. So when these hormone levels fall, it makes it hard for the sex hormones like estrogen and testosterone to be produced along with thyroid hormones. So how does one system affect the other systems? Like I said the entire time, when oxygen isn't getting, nutrition isn't going around, blood isn't able to circulation because you're so skinny and tiny, you don't have enough muscle strength to get your whole body moving. Your brain is moving a lot slower than it once was. It's not working properly, and it causes a lot of issues. It causes the other organs to work in overtime, and then slowly they won't be able to keep that up and they start to die off. So you can see here, this is what letting go is. This is a type of hair that is grown when your body can't control how cold you are. This other consequences include blood cells. Treatments can be done in a team approach. It has many people involved, including family, doctors, clinicians, and psychiatrists. Not everyone's going to fit well with everyone, and there's definitely different techniques of getting through to a person, and this isn't something that you can just shove food in their face and tell them to eat and it's going to make it all better, because it's going to send them on a backward spiral, and it's really hard for them to recover from that. And unfortunately, there are no medications at this time that are proven to help these cases. They're only medications to help out with other psychiatric issues that are going on. And here are my references.